Understanding sciatica, a pain in the back and leg. Sciatica is not a disease. It is a symptom of a problem in your lower back. This problem puts pressure on your sciatic nerve. The sciatic nerve is a large nerve. It runs from your lower back down each leg. It is the longest nerve in your body. Sciatica causes pain. The pain runs from your lower back down your leg. It can be a mild ache. It can also be a sharp burning pain. The pain may be worse when you sit, stand, or cough. You may also feel numbness, tingling, or weakness in your leg or foot. Sciatica is common. It affects millions of people. It can make it hard to do everyday activities. Understanding sciatica is the first step to finding relief. Causes of sciatica. When things go wrong in the spine. The most common cause of sciatica is a herniated disc. Discs are like cushions between the bones in your spine. They act as shock absorbers. A herniated disc occurs when the soft, jelly-like center of a disc pushes through the tough outer layer. This can happen with age or injury. When this happens, it can press on the sciatic nerve. Another common cause of sciatica is bone spurs. Bone spurs are bony growths that can form on the bones of your spine. They can develop due to aging or arthritis. Like herniated discs, bone spurs can also compress the sciatic nerve.
Other conditions can also cause sciatica. These include spinal stenosis, piriformis syndrome, and pregnancy. Spinal stenosis is a narrowing of the spinal canal. The spinal canal is the space that houses the spinal cord and nerves. Piriformis syndrome occurs when the piriformis muscle, a muscle located in the buttock, compresses the sciatic nerve. Pregnancy can also cause sciatica. This is because the growing uterus can put pressure on the sciatic nerve.
Recognizing the signs and symptoms of sciatica. Sciatica pain is often described as a sharp shooting pain. It can also feel like a burning or tingling sensation. The pain usually starts in your lower back. It then radiates down the back of your leg. It can travel all the way to your foot. The pain may be worse when you sit or stand for long periods. It may also be worse when you cough or sneeze.
In addition to pain, you may also experience numbness, tingling, or weakness in your leg or foot.
It is important to see a doctor if you have any of these symptoms. Sciatica can sometimes be a sign of a more serious condition.
Section 4. Diagnosis, getting to the root of the problem. Diagnosing sciatica usually involves a physical exam and your medical history.
Your doctor will ask about your symptoms. They will want to know when they started and what makes them better or worse.
They will also examine your back and legs. They will be looking for areas of tenderness, weakness, or numbness.
Your doctor may also order imaging tests. These tests can help to confirm the diagnosis of sciatica. They can also help to rule out other conditions.
Imaging tests that may be used to diagnose sciatica include X-rays, MRI scans, and CT scans. X-rays can show the alignment of your bones. MRI scans can show the soft tissues of your spine, such as the discs and nerves. CT scans can provide more detailed images of the bones in your spine. Section 5. Treatment options. Finding relief from sciatica. The good news is that most cases of sciatica resolve on their own with time and conservative treatment. This typically involves rest, ice and heat therapy, and over-the-counter pain relievers.
Your doctor may recommend physical therapy. This can help to strengthen the muscles that support your back. It can also improve your flexibility and range of motion.
In some cases, your doctor may recommend medications. These may include muscle relaxants, corticosteroids, or antidepressants.
In rare cases, surgery may be necessary. This is usually only recommended if other treatments have failed to provide relief, or if you are experiencing significant weakness or loss of bowel or bladder control.
If you are experiencing sciatica pain, it is important to see a doctor to get a proper diagnosis and discuss treatment options. With the right treatment, most people with sciatica can find relief from their pain and return to their normal activities.